Anemia. Anemia is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your body's tissues. Having anemia can make you feel tired and weak. There are many forms of anemia, each with its own cause. Anemia can be temporary or long-term, and it can range from mild to severe. See your doctor if you suspect that you have anemia. It can be a warning sign of serious illness. Treatments for anemia range from taking supplements to undergoing medical procedures. You might be able to prevent some types of anemia by eating a healthy, varied diet. Symptoms. Anemia signs and symptoms vary depending on the cause. If the anemia is caused by a chronic disease, the disease can mask them, so that the anemia might be detected by tests for another condition. Depending on the causes of your anemia, you might have no symptoms. Signs and symptoms, if they do occur, might include fatigue, irregular heartbeats, shortness of breath, chest pain, headaches. At first, anemia can be so mild that you don't notice it. But symptoms worsen as anemia worsens. When to see a doctor. Make an appointment with your doctor if you're feeling fatigued and you don't know why. Fatigue has many causes besides anemia, so don't assume that if you're tired you must be anemic. Some people learn that their hemoglobin is low, which indicates anemia, when they donate blood. If you're told that you can't donate because of low hemoglobin, make an appointment with your doctor. Causes. Anemia occurs when your blood doesn't have enough red blood cells. This can happen if your body doesn't make enough red blood cells. Bleeding causes you to lose red blood cells more quickly than they can be replaced. Your body destroys red blood cells. What red blood cells do? Your body makes 3 types of blood cells: white blood cells to fight infection, platelets to help your blood clot, and red blood cells to carry oxygen throughout your body. Red blood cells contain hemoglobin, an iron-rich protein that gives blood its red color. Hemoglobin enables red blood cells to carry oxygen from your lungs to all parts of your body and to carry carbon dioxide from other parts of the body to your lungs to be exhaled. Most blood cells, including red blood cells, are produced regularly in your bone marrow, a spongy material found within the cavities of many of your large bones. To produce hemoglobin and red blood cells, your body needs iron, vitamin B12, folate, and other nutrients from the foods you eat. These factors place you at increased risk of anemia. A diet lacking in certain vitamins and minerals. A diet consistently low in iron, vitamin B12, and folate increases your risk of anemia. Intestinal disorders. Having an intestinal disorder that affects the absorption of nutrients in your small intestine, such as Crohn's disease and celiac disease, puts you at risk of anemia. Menstruation. In general, women who haven't had menopause have a greater risk of iron deficiency anemia than do men and postmenopausal women. Menstruation causes the loss of red blood cells. Pregnancy. If you're pregnant and aren't taking a multivitamin with folic acid and iron, you're at an increased risk of anemia. Chronic conditions. If you have cancer, kidney failure, diabetes, or another chronic condition, you could be at risk of anemia of chronic disease. These conditions can lead to a shortage of red blood cells. Slow, chronic blood loss from an ulcer or other source within your body can deplete your body's store of iron, leading to iron deficiency anemia. Family history. If your family has a history of an inherited anemia, such as sickle cell anemia, you also might be at increased risk of the condition. Other factors. A history of certain infections, blood diseases, and autoimmune disorders increases your risk of anemia. Alcoholism, exposure to toxic chemicals, and the use of some medications can affect red blood cell production and lead to anemia. Age. People over age 65 are at increased risk of anemia. Complications. Left untreated, anemia can cause many health problems, such as severe fatigue. Severe anemia can make you so tired that you can't complete everyday tasks. Pregnancy complications. Pregnant women with folate deficiency anemia may be more likely to have complications, such as premature birth. Heart problems. Anemia can lead to a rapid or irregular heartbeat, arrhythmia. When you're anemic, your heart must pump more blood to make up for the lack of oxygen in the blood. This can lead to an enlarged heart or heart failure. Death. Some inherited anemias, such as sickle cell anemia, can lead to life-threatening complications. Losing a lot of blood quickly results in acute, severe anemia and can be fatal. Prevention. Many types of anemia can't be prevented. But you can avoid iron deficiency anemia and vitamin deficiency anemias by eating a diet that includes a variety of vitamins and minerals, including iron. Iron-rich foods include beef and other meats, beans, lentils, iron-fortified cereals, dark green leafy vegetables, and dried fruit. Folate. This nutrient, and its synthetic form folic acid, can be found in fruits and fruit juices, dark green leafy vegetables, green peas, kidney beans, peanuts, and enriched grain products, such as bread, cereal, pasta and rice.